The role of the TROP2 biomarker in cancer. TROP2 is a protein that sits within the surface of certain cells, mainly epithelial cells. Epithelial cells line various body surfaces, like skin, blood vessels, and hollow organs. It is thought that TROP2 helps regenerate these cells. The TROP2 protein is a receptor. It helps relay signals to the cell that instruct it to perform a particular function. While TROP2 is found only sporadically in healthy cells, in numerous cancers, the tumor cells have too many TROP2 receptors, called TROP2 overexpression. This is seen, for example, in a high percentage of breast cancers, lung cancers, and colon, pancreatic, gynecological, and gastric cancers. Scientists have discovered that TROP2 can send signals involved in the formation and progression of many types of cancer. The exact role of TROP2 varies depending on the cancer and type of cells. That's because TROP2 can use multiple signaling pathways to direct the activity of cancer cells. In certain cancers, for example, TROP2 signaling can lead cells to divide, producing 2, then 4, then 8 cells and so on to form a tumor. And instead of naturally dying off the way healthy cells do, TROP2 signaling helps some cancer cells to survive. TROP2 signaling can also generate a blood supply that can feed and nourish a tumor, or reduce the adhesion cells use to stick together, allowing cells to migrate to other parts of the body where new tumors can form. It can also play a role in drug resistance. And in some cases, TROP2 is involved in suppressing tumor growth. Since TROP2 is overexpressed in so many cancers, this makes it a good target for drugs that can precisely locate and destroy cancer cells. So researchers are developing drugs using various methods to target TROP2, like monoclonal antibodies that can locate and bind to the TROP2 protein, bispecific antibodies that can act like an immunotherapy by latching on to both TROP2 and a T cell to help destroy cancer cells, and antibody-drug conjugates, or ADCs, the first of the TROP2 targeting drugs to be approved in the US. ADCs use an antibody to deliver and then release a payload consisting of a strong chemotherapy directly into cancer cells. The goal with each approach is to target and destroy cancer cells and limit harm to healthy cells. While TROP2 targeting drugs offer new hope to people with advanced cancer, like other cancer treatments, these drugs do have side effects, some of which can be serious. That's why it's so important to discuss your specific case with your doctor. Together, you can weigh the risks and benefits of your treatment options. Cancer Care provides free resource navigation, individual counseling, and support groups over the phone, virtually, and in person with oncology social workers and resource navigators who specialize in helping people affected by cancer. To talk with one of our social workers, call 1-800-813-HOPE. That's 1-800-813-4673. Our social workers can help you navigate the emotional, practical, and financial challenges of cancer. The information presented in this video is provided for your information only. It is not intended as a substitute for medical advice. We encourage you to take information and questions to your healthcare provider.